morning to all ACP members. My name is Jarold Mendez. I am a second-year infectious disease fellow at the VA hospital, and the title of my case is "In a conflict between the heart and the brain, the fish was to blame." The history of present illness: this is a 78-year-old man with past medical history of aortic valve replacement, amongst others, who began to consume more fish, including salmon, prior to his presentation. He had a traumatic fall from his bed just 2 weeks prior to his admission. He had an MRI done showing no infectious process. A week before presentation, he became disoriented and combative. And the morning of his admission, he woke up with lack of appetite and generalized weakness. Patient is allergic to aspirin. He was consuming alcohol, but the quantity is uncertain due to the patient's altered mental status. He traveled to Florida just 1 year ago, and he had a dog as a pet 1 year ago who died. In terms of the surgeries he had a transcatheter aortic valve replacement surgery in 2017, and his vaccines were up to date. Here are a list of his medications. Notice the use of pregabalin and tramadol, although he did not know how much of them he was taking. His physical exam was remarkable for a disoriented patient who followed just simple commands, with a 3 out of 6 systolic ejection murmur at the right upper sternal border, with diminished lower extremity reflexes. Up until this point, our differential diagnosis was broad and included sepsis, CVA, polypharmacy or substance abuse, meningoencephalitis. The patient was started on cefepime, acyclovir, and vancomycin. A lumbar puncture could not be performed due to the patient's combative behavior. A CT of the head, as shown in this slide, did not reveal any pathological finding, except for cerebral atrophy. A chest X-ray was remarkable for cardiomegaly, but did not have any pulmonary infectious process. Infectious disease services was consulted in the case, and ampicillin was added to the regimen. At this point, blood cultures were preliminarily reporting gram-positive cocci in chains. A transthoracic echocardiogram was performed, which showed an oscillating vegetation of 0.6 centimeters in the anterior leaflet of his bioprosthetic valve, as shown in the picture. His final blood cultures grew Lactococcus garviae with the shown sensitivities, for which the patient was de-escalated to ceftriaxone to complete 6 weeks. Lactococcus garviae was first described in the 1950s in Japan's farm as a cause of disease in fishes. It was previously confused with enterococci due to its morphologic appearance. Later, after its discovery, it has been reported as a pathogen in patients who consume raw or undercooked fish, as in the case of our patient. This case is relevant as there are very few reported cases in the literature. Most of these cases have had endocarditis, as in the case of our patient, and almost all of the reported patients had consumed raw fish. In our patient, he consumed salmon. Affection of the prosthetic valve is also a common finding in almost all reported cases. In our patient, who also had a prosthetic valve, which makes this case unique and part of the very few reported cases in the literature. This is the end of my presentation. Thank you for your attention, and here are my references.